But treatment must begin immediately and be kept up regularly. The disease is highly contagious, and you owe it to your family and to your shipmates, as well as to yourself, to take no chances. Report to your medical officer at once. He is qualified to diagnose and treat you properly, and your case will be followed until a cure is complete. The symptoms of the secondary stage will also disappear in time, even if neglected. But the disease is still present and now spreads to other, more vital parts of the body, where it may lurk unnoticed for many years. When it eventually reappears, however, it may cause ulcers of the skin or of the bones, damage to the heart, or other serious circulatory disorders, rupture of the blood vessels of the brain or the spinal cord, paralysis, and insanity. No organ of the body is immune to attack. So don't delay seeking medical advice. Every moment that you do increases the danger to yourself and to others, and reduces your chances of ever being cured. All of these diseases are preventable, and their prevention requires neither complicated equipment nor extensive technical knowledge. It's a matter of a few simple precautions plus a little ordinary common sense. First, there are several elementary facts to be kept in mind. Most prostitutes are infected. The average free pickup is also likely to be infected. Obviously, then, the surest way to avoid venereal disease is to avoid sexual contact with all promiscuous women, whether they demand money or not. There are many places within a woman's sex organs in which germs may escape detection, in spite of repeated examinations by even a competent physician. For this reason, any medical certificate which a prostitute may produce is worthless. Moreover, she may easily have become infected half an hour after her examination. But if, despite this danger, you should expose yourself, there are preventive measures which will diminish the risk. The most effective single method is the condom or rubber sheath, which, when correctly placed on the penis, acts as a shield between it and the hidden germs. The condom must be perfect. A single pinhole renders it worthless. Extreme care is necessary in the use of the condom. Roll it on the penis with about half an inch left loose at the tip to guard against tearing. If a lubricant is desired, use a non-oily one, such as surgeon's jelly, for oily substances destroy rubber very quickly. Do not use Vaseline or other petroleum products. In removing the condom, remember that the outside may have millions of germs on it if the woman is infected, and is therefore very dangerous. Roll or pull it off, turning it inside out in the process. The germs are thus kept inside, where they can do no harm. But there are many vulnerable points not protected by even the best condom. Any point of contact may become infected. In this case, the chancre appeared at an unprotected spot. So the condom alone, without further precautions, is never enough, and it is essential that additional protective measures be taken. The first step in prophylaxis is to urinate. The stream of urine forces from the urethra many of the germs that may have entered it. Next, wash thoroughly with soap and water the penis, the scrotum, the pubic hair, the inside of the thigh, the belly, the hands, and any other part of the body that may have come in contact with the secretions of the woman or the outside of the condom. Do not forget, it is most important to pull back the foreskin and wash thoroughly underneath it. After carefully drying the penis, use one of the individual prophylactic tubes available at the sick bay, unless you can get prophylactic treatment at a regular shore station or at the sick bay within an hour. Since these tubes are effective only when properly used, you must be sure to follow the directions carefully. First, inject into the urethra about half of the contents of the tube, grasping the head of the penis at once to prevent escape of the ointment. Second, massage the penis for at least 3 minutes so as to spread the ointment thoroughly over the inside walls of the urethra. This is necessary because of the many tiny pockets and recesses on its interior surface in which germs may escape the ointment. Third, rub the remainder of the ointment over the entire length of the penis, around its base, the front of the scrotum, and over the groins. Be sure to pull back the foreskin and rub the ointment in well under it and around the G-string. Rub the ointment into the penis itself for 5 minutes. Allow the ointment within the penis to remain 4 or 5 hours, or until it becomes necessary to urinate. The ointment on the outside of the penis and the surrounding parts should be allowed to remain for 12 hours. Wrap the penis in the waxed paper provided with the tube to avoid soiling your clothes. If you use a good condom together with chemical prophylaxis, your chances of avoiding venereal diseases are far better than if they are omitted. But remember, prophylaxis must be administered immediately following exposure and after every exposure, not merely the last one. The germs won't wait, and neither can you. Research has shown that the value of prophylaxis diminishes rapidly the longer you wait. After 2 hours, your chances of getting a venereal disease are more than 7 times as great as after 1 hour. And after 5 hours, you are 18 times as likely to become infected. This prophylactic routine, together with the condom, should be carefully employed. But if for any reason you are unable to follow this procedure in every detail, report as soon as possible to the dispensary, sick bay, or shore prophylactic station. This is most important. At the station, you are given a complete prophylaxis by a trained hospital corpsman. The first step in a station prophylaxis is a thorough washing with soap and water. This kills many germs that may still be on the surface of the skin. A silver preparation is then used as a preventive of gonorrhea. This is usually protargol or argyrol and should be held in the urethra at least 5 minutes. It is followed by the application of calomel ointment, a mercury compound used in the prevention of syphilis. This treatment is simple and painless, but should be taken directly following exposure for maximum effect. These prophylactic stations are available at Army or Marine Corps barracks, at shore stations, and on board ship. They are put there for you. Use them for your protection. You have the facts. We've told you everything of importance about these diseases. To sum up briefly, continence is the only sure way to avoid infection. However, if you do expose yourself, use a good condom and follow it by immediate and thorough prophylaxis. Don't get drunk and carelessly expose yourself without protection. A drunken man loses his sense of judgment and foolishly takes chances he wouldn't think of taking when he is sober. But if you should contract a venereal disease, don't try to conceal it. For an untreated venereal disease is extremely dangerous to your shipmates, to your family, and to yourself and your future. The Navy supplies you with expert medical attention. It does everything possible to safeguard and preserve your health. But it's up to you to use your own common sense. Take advantage of this, for no one can help you if you will not help yourself.